Depression is a mental health disorder that affects how a person feels, thinks, and behaves. It can manifest in feelings of sadness, loss of interest in activities that were once enjoyable, and changes in appetite or sleep patterns. People with depression may also feel hopelessness, guilt, worthlessness, or be unable to focus. In some cases, it can cause physical symptoms such as fatigue and headaches. Treatment typically involves one or more forms of therapy such as cognitive behavioral therapy, CBT, and medications like antidepressants. Depression isn't just feeling down for a few days, it's an ongoing problem that affects nearly every aspect of life and can last for weeks or months at a time. Symptoms vary from person to person but generally include persistent low moods accompanied by a lack of energy, difficulty concentrating, changes in appetite, sleeping problems, social levels, can cause depression. Low serotonin levels are associated with feelings of sadness and anxiety and can lead to disruptive sleep patterns which may contribute to symptoms of depression. As hormones fluctuate throughout our lives due to events such as puberty and menopause, these imbalances may become more pronounced and lead to feelings of despair or hopelessness. Environmental factors such as stress, trauma or social isolation can also trigger symptoms associated with depression. Stressful life events such as job loss, relationship problems or bereavement can trigger an episode of depressed moods if they occur frequently enough or are particularly traumatic in nature. Additionally, lack of meaningful social support networks could result in feelings of loneliness which could further contribute to depressive episodes. Low mood and loss of interest are two of the most common symptoms associated with depression. Low mood is characterized by feelings of sadness and emptiness, coupled with a lack of enjoyment in activities that once gave someone pleasure. The loss of interest can be further broken down into an inability to concentrate or take part in activities due to an apathy towards them, as well as a complete lack of motivation. This can lead to an individual feeling like they cannot cope, or even wanting to give up on life altogether. The effects these symptoms have on one's daily life can range from mild disruptions such as missing work or school days due to a lack of energy, to more severe issues such as suicidal thoughts. In addition, low mood and loss of interest may cause changes in sleeping patterns such as insomnia or oversleeping, difficulties with eating including changes in appetite, irritability and negative thoughts about oneself. If left untreated for too long, low mood and loss of interest can become very debilitating for those suffering from depression. However, there are effective treatments available which focus on addressing these particular symptoms along with promoting healthy coping skills. These include various types psychotherapy which involves working through underlying problems contributing to the depression alongside lifestyle modifications and medications if necessary. The medical evaluation for diagnosing depression is typically a thorough process that can take several hours. It usually begins with the practitioner taking a detailed history, including family and personal medical histories, current medications, lifestyle habits, for example, diet, exercise, and other factors that may be relevant to the patient's mental health: withdrawal, irritability, decreased sex drive, thoughts of death/suicide/self-harm, restlessness/agitation, exaggerated physical complaints like headaches and muscle aches, substance abuse issues such as alcohol consumption and taking drugs to reduce stress levels, increased sensitivity to criticism, rejection or failure. It is important to note that these symptoms must persist for at least 2 weeks before being diagnosed with clinical depression. Major depressive disorder is the most common type of depression. It is characterized by a persistent feeling of sadness and loss of interest in everyday activities that can last for weeks or longer. People with major depressive disorder may also experience changes in appetite, difficulty sleeping or sleeping too much, physical aches and pains, and impaired concentration. Persistent depressive disorder, formerly known as dysthymia, is a type of chronic depression that lasts for 2 years or more. Symptoms include feelings of sadness and hopelessness, low self-esteem, difficulty making decisions, lack of energy, problems with sleep and appetite, poor concentration, and feelings of worthlessness or guilt. This condition can significantly interfere with daily activities such as work or school performance. Atypical depression is a form of depression characterized by moods that are unusually reactive to positive events. For example, people with atypical depression might feel happier when someone gives them a compliment but quickly return to feeling depressed once the moment has passed. Other symptoms include increased appetite and weight gain due to overeating, oversleeping, heavy and leaden feeling limbs, sensitivity to criticism, anxiety, fatigue, inability to concentrate on tasks, irritability, social withdrawal, loss of libido, pessimism about future prospects, suicidal thoughts or behaviors, extreme sensitivity to rejection or failure. Genetic factors can play a role in the development of depression. Studies have shown that people with a family history of depression are more likely to experience it themselves. There is also evidence to suggest that certain genes can make someone more prone to developing depressive symptoms. Hormonal imbalances, such as changes in serotonin. The physician may also ask about stressors in the patient's life or any recent changes in behavior or mood that could indicate an episode of depression. After gathering this information, the practitioner will likely perform a physical exam and laboratory tests to rule out any underlying medical causes of the symptoms being experienced by the patient. This may include tests such as blood work or imaging studies to look for structural abnormalities in areas of the brain associated with depression. In some cases, psychological testing may also be conducted to assess cognitive functioning or personality characteristics. Based on all of these findings, a diagnosis of depression can then be made and appropriate treatment can be started if necessary. Therapy is a common form of treatment for depression. Cognitive behavioral therapy, CBT, is one such therapy which focuses on identifying and changing negative thought patterns and behavior associated with the disorder. CBT helps people identify problems they are facing, develop healthy coping strategies, and ultimately lead to improved quality of life. Other forms of psychotherapy, such as interpersonal therapy, IPT, may also be used to address issues related to depression by focusing on relationships between individuals and their environment. Medication is another type of treatment for depression. Antidepressants can help alleviate symptoms by increasing serotonin levels in the brain. Common classes of antidepressants include selective serotonin reuptake inhibitors, SSRIs, tricyclic antidepressants, TCAs, monoamine oxidase inhibitors, MAOIs, atypical antidepressants, norepinephrine dopamine reuptake inhibitors, NDRIs, and other newer drugs. It's important to note that medications should only be used under the supervision of a doctor since they come with potential side effects or risks including weight gain, insomnia, or sexual dysfunction. Eating a healthy diet is an important part of preventing depression. Eating a balanced diet that includes plenty of fruits and vegetables, whole grains, healthy fats, and lean proteins can help keep your body and mind strong. Eating nutrient-dense foods can also help boost your mood by providing essential vitamins and minerals that are vital for mental health. Additionally, getting regular exercise can be beneficial in preventing depression as well. Exercise increases the production of endorphins, which are hormones that make you feel good. It also helps to reduce stress levels, which is one of the major causes of depression. Exercise can also improve sleep quality, which has been linked to improved mental health. Finally, exercise gives you a sense of accomplishment when you complete something like going for a walk or run or even just doing some stretching at home. This feeling of accomplishment can be very beneficial in helping prevent depression from taking hold in your life.